May 10, 2021 is being observed as World Lupus Day. How much do you know about lupus? Come with me on this journey and let us find out more about lupus. What is lupus? Lupus is a chronic long-term disease that can cause inflammation and pain in any part of your body. It is an autoimmune disease, which means that your immune system, the body system that usually fights infection, attacks healthy tissues instead. What causes lupus? Hormones, genetics, and environmental agents are said to be linked to the cause of lupus. Other causes of lupus include ultraviolet rays from the sun and/or fluorescent light bulbs, sulfur drugs, which make a person more sensitive to the sun, such as sun sensitizing, penicillin and other antibiotic drugs, emotional stress, physical stress, exhaustion, infections, cold or viral illnesses, anything else that causes stress to the body, such as surgery, physical harm, injury, pregnancy, or giving birth. Symptoms of lupus. Common lupus symptoms include extreme fatigue, feeling tired all the time, pain or swelling in the joints, swelling in the hands, feet or around the eyes, headaches, and low fevers. What are the types of lupus? There are 4 types of lupus: systematic lupus, cutaneous lupus, drug-induced lupus, and neonatal lupus. Systematic lupus. Systematic lupus is the most common form of lupus. This can cause inflammation of multiple organs in the body. Symptoms of systematic lupus include skin rashes, pain or swelling in the joints, also known as arthritis, swelling in the feet and around the eyes, typically due to kidney involvement, extreme fatigue, and low fevers. Cutaneous lupus. This type of lupus is manifested in a skin disease which can cause rashes and sores or lesions in sun-exposed areas such as the arms, face, ears, and neck. There are 3 forms of cutaneous lupus: chronic cutaneous lupus, subacute cutaneous lupus, acute cutaneous lupus. Right. Chronic cutaneous lupus or discoid lupus. This type appears as a disc-shaped round lesion appearing on the face scalp and sometimes on other parts of the body. Approximately 10% of the people with discoid lupus later develop lupus in other organ systems. Subacute and acute cutaneous lupus. Subacute cutaneous lesions may appear as areas of red, scaly skin with distinct edges or as red ring-shaped lesions, while acute cutaneous lesions occur when your systematic lupus is active. The most typical form of acute cutaneous lupus is a malar rash, flattened area of red skin, or on the face that resembles a sunburn. Drug-induced lupus. Drug-induced lupus is a lupus-like disease caused by certain prescription drugs. The symptoms of drug-induced lupus include muscle and joint pain, sometimes with swelling, flu symptoms of fatigue and fever, serositis, inflammation around the lungs or heart that causes pain or discomfort, certain laboratory test abnormalities. Neonatal lupus. This is a rare condition associated with anti-SSARO or anti-SSBLA antibodies from the mother that affects the fetus. At birth, the baby may have skin rash, liver problems, or low blood cell counts. The symptoms usually disappear completely after 6 months with no lasting effects. Diagnosing lupus. To diagnose lupus, a doctor will look for signs of inflammation in the body, which include pain, heat, redness, swelling, and loss of function at specific places in the body. Other ways of diagnosing lupus include blood tests, complete blood count, antibody tests, and biopsies. There is no cure for lupus, but treatments can help patients feel better and improve their symptoms. Treatment will depend on a patient's symptoms and needs. The goals of treatment are to prevent flares, treat symptoms when they happen, reduce organ damage and other problems. Treatment might include medicines to reduce swelling and pain, calm the immune system to prevent it from attacking the organs and tissues in the body, reduce or prevent damage in the joints, reduce or prevent organ damage. Treatment of lupus. Treatment of lupus includes administration of non-steroidal anti-inflammatory drugs, corticosteroids, anti-malarial drugs, administering belimumab, a B lymphatic stimulator protein inhibitor, immunosuppressive agents such as chemotherapy in severe cases when major organs are affected and other treatments do not work. Other medicines are also needed in some cases to treat illnesses linked to lupus, such as high blood pressure or osteoporosis. Thank you for taking time out to view the information on lupus. Give your support to someone who is living with the disease.